Joining us now is Dr. Céline Gounder, who served on then-President-elect Biden's transition COVID-19 advisory board. And she's also an epidemiologist and infectious disease expert at the NYU Grossman School of Medicine and Bellevue Hospital, both right here in New York City. Dr. Gounder, thank you for being here. On behalf of the 16 million Americans who have the Johnson & Johnson shot, how should they feel about the CDC now saying, get another one if you can?
Get another one that's not Johnson & Johnson.
That's not Johnson & Johnson, yeah.
Yeah, if you have not yet gotten that additional dose of either Pfizer or Moderna vaccine, that really is very important now, especially with the spread of the Omicron variant. We are not seeing adequate protection with the Johnson & Johnson vaccine alone.
Should they be worried about the blood clots if they've already got the shot?
If you've already had the shot, if you're within maybe a week or two of getting the shot, there may be some concern. But if you're farther out, you really are outside the window of risk now.
So let's talk big picture. Everyone's worried about Omicron. Cases are rising. We're talking about doubling every 2 days. But are cases really the right measure here, or should we be focused on hospitalizations and deaths?
So this is a great question. I think we really need to reframe what is a win, what our expectations are. If we can turn Omicron, if we can turn COVID into something like the common cold through vaccination, that's a win. And we're well on our way to doing that, but everybody needs to get vaccinated to get there.
I know we keep hearing that, Céline, but we also keep hearing cases in New York have doubled in the last 48 hours. You see people waiting in line for a test up to 3 hours. How are we supposed to process this? What do we need to know? What do we need to do to be safe? Because when you hear the cases are on the rise, you think, okay, I'm in trouble, even if you're double vaxxed and boosted.
We are certainly seeing breakthrough infections among people who are double vaxxed and even boosted. But they are mild cases. These are cases of the sniffles. These are not landing people in the hospital. But if you really want to be extra safe, first of all, get your 2 vaxes and your booster. But in addition, continue to mask and use a higher grade mask. We now know those N95 or KN95 masks are better than the surgical and cloth masks. You have less leakage of air around your mouth. So definitely make use of those. Open doors and windows. Have your holiday gatherings outdoors, which is precisely what the president is
This
doing.
is a big weekend for holiday parties and gatherings. Should people even still be having holiday parties and gatherings under these circumstances?
I think it's okay to do, but really do it outdoors. And if you're not doing it outdoors, have all the doors and windows open in the space, have one of those HEPA air filtration units in the space, and keep the numbers of people really to a minimum.
Hold on, you said cases of the sniffles is primarily what we're seeing among vaccinated Americans and especially boosted Americans.
Right.
If that's the case, do we need people being sent home from school, sent home from the office?
My daughter just got sent home
Yeah.
because she was recently exposed to someone who might have had it, and they weren't even sure. So that's a great question, Tony.
It is a good question, and part of the issue is that still, even in New York City, where we have high vaccination rates, 30% of people are still not vaccinated. And so if there is transmission, there are still people who are very much vulnerable. You have some people who are highly immunosuppressed who do not respond to vaccines. So having transmission in a school, for example, would still put somebody like that at risk.
In the beginning of the year, it seems like we were all on this boat, and the waters were rough. And land to us was December. Getting into 2022, it seems like we're going to finally get over that hump. We've asked this time and time again, when will we get over this hump? When will we start to feel normal again? And there isn't such a panic when we start talking about COVID.
Absolutely.
I think this all depends on us. You know, if we step up, if we get
And I'm
vaccinated.
worried if we got to depend on us, because us ain't doing the right thing. It's scary.
You know, and I think we really need to start looking out for one another, thinking of ourselves as one another's neighbors, our, brother's keeper, so to speak. And that's really what will get us over this. That's hitting the fast forward button on the pandemic, is getting vaccinated.
Part of this is a political question, and Governor Polis in Colorado made some headlines a few days ago by saying, look, we have the vaccines. The emergency is over. If you get sick now, it's entirely your fault. What do you think about that approach?
Well, the challenge is if I'm a doctor who's seeing you in the emergency room, on the wards, I don't get to turn anybody away just because they haven't been vaccinated or they're a smoker or whatever it is. We don't treat people that way. We welcome everybody regardless of what they've done.
But aren't you frustrated with those people? It just makes it so much more difficult for others who are doing the right thing.
Well, trust me, we're those of us working in the hospital are very frustrated. We're tired.
But they deserve care.
Everybody deserves care. Everybody deserves, the best we can do.
Right.
All right. Happy holidays, everybody.
Happy holidays.
Merry Christmas.
Merry Christmas.
Thank you for coming in. We really appreciate it.